Let's start by going over exactly what we'll cover in this video. We'll begin by understanding what coronary heart disease is and how it develops. Next, we'll look at how stents are used to keep coronary arteries open and restore blood flow. Then we'll explore the role of statins in reducing blood cholesterol levels. We'll also discuss mechanical devices and heart transplants for treating severe heart failure. And finally, we'll examine how damaged heart valves can be replaced using biological or mechanical alternatives, along with blood substitutes in cases of major blood loss. Coronary heart disease is a major health issue that affects many people. It occurs when the coronary arteries, which supply blood to the heart muscle, become narrowed. This narrowing happens because fatty materials build up inside these arteries, forming layers that reduce the flow of blood. When the heart muscle doesn't get enough oxygen from the blood, it can't function properly. As these fatty deposits increase over time, the space inside the arteries gets smaller and smaller. This means less and less blood can flow through to deliver oxygen to the heart muscle. If blood flow becomes severely restricted, a person may experience chest pain. In a worst case scenario, if an artery becomes completely blocked, part of the heart muscle can die, resulting in a heart attack. One effective treatment for narrowed coronary arteries is the use of stents. Stents are small, tube-shaped devices that are placed inside affected arteries. These clever devices physically hold the blood vessel open, allowing blood to flow through more easily. This ensures the heart muscle receives the oxygen it needs to function properly. Stents offer several advantages for patients. They're relatively non-invasive compared to major heart surgery, and recovery times are typically shorter. Once in place, they provide long-term benefits by keeping the artery open. However, stent procedures do come with some risks. There's a small chance of complications during the procedure itself. After placement, there's a risk of blood clots forming around the stent, causing thrombosis. Another important treatment for coronary heart disease involves medications called statins. These drugs help to reduce the levels of cholesterol in the blood. Cholesterol is a fatty substance that's actually essential for our bodies. We need it to build cell membranes and make certain hormones. However, when we have too much of the wrong type of cholesterol, it can contribute to those fatty deposits in our arteries. Statins work by reducing how much cholesterol our body produces, particularly the harmful type known as LDL cholesterol. By lowering these levels, statins slow down the buildup of fatty deposits in the arteries. For many patients, taking statins regularly can significantly reduce their risk of heart attacks and stroke. These medications may also help to stabilize existing deposits, preventing them from suddenly breaking off and blocking an artery completely. Like all medications, statins can have side effects. Some people experience muscle aches, headaches, or digestive issues. In rare cases, they can cause more serious problems with the liver or muscles. Another con of using statins is that they can take weeks or months to have any noticeable effect, and a patient will need to continue taking them to keep receiving the health benefits. If they stop, the condition will likely continue to worsen. In cases where a heart attack has occurred, more drastic interventions may be necessary. Sometimes the heart becomes so weakened that it can no longer pump blood effectively. For patients with severe heart failure, a heart transplant might be the best option. This involves replacing the damaged heart with a healthy donor heart. While this can be life-saving, finding suitable donor hearts is challenging, and patients may wait months or years. During this waiting period, or for patients who aren't suitable transplant candidates, mechanical heart devices can provide a solution. These devices help the weakened heart pump blood more effectively. Some mechanical devices are designed to support the heart temporarily until a donor heart becomes available. Others may be used as a long-term solution when transplantation isn't possible. The advantage of mechanical devices is they're immediately available and don't trigger immune rejection. However, they require major surgery to implant, and patients often need to take blood thinning medications to prevent clots from forming. Heart valves are another part of the heart that can be damaged. These valves control the direction of blood flow through the heart, ensuring it moves forward efficiently. When heart valves become damaged or diseased by old age or a heart attack, they may not open fully or they may be unable to fully close. Either way, the heart has to work harder to pump the same amount of blood. Faulty heart valves can be replaced in surgery. Surgeons might use biological valves, which come from human donors or animals. Alternatively, they may use mechanical valves made from durable synthetic materials. Biological valves work very naturally but typically need replacing after a certain number of years. Mechanical valves last longer but require patients to take blood thinning medication for life to prevent clots from forming on the valve. In situations involving major surgery or injury, patients may experience significant blood loss. While blood transfusions are the standard treatment, there are times when donated blood isn't available or can't be used. This is where blood substitutes become important. Blood substitutes are artificial substances designed to perform some of the functions of blood, particularly carrying oxygen to tissues. Unlike donated blood, these substitutes don't require blood type matching and have a longer shelf life. Currently available blood substitutes include saline-based solutions. These can be used in emergency situations to stabilize patients until proper blood transfusions become available or until their body produces more blood cells to replace the lost blood. Our understanding of heart disease and its treatments has advanced tremendously over recent decades. What was once a death sentence can now often be managed effectively, allowing patients to lead full and active lives.